Good day everyone, I am Daniela Soneja, a student nurse from Cotanduanes State University, and for today I will be performing a written demonstration on the assessment of the head, neck, eyes, ears, nose, and mouth. So prior to performing this procedure, I will be going to perform first a proper hand hygiene and put on necessary PPE, and after that, we can now proceed to the assessment. Good morning, ma'am. I am Daniela Soneja, your student nurse for today. Kindly confirm po your name, birthday, and age, ma'am.
Alexia po. November 22, 2002, 19 years old.
So that is the first thing that we should do before performing any procedure on the client, confirming their identity to ensure we have correct patient in front of us. If there are any curtains or any door in the room, we want to close that for privacy of the patient, and after that, we can now proceed to explaining the purpose of the assessment to the client. So, ma'am, how do you want me to call you po?
Alexia.
So for today, I am here in order to perform an assessment on your eyes, ears, neck, mouth, and other facial features to ensure that everything is normal. If there are any abnormalities, we are going to take note of them for the further complication. Anyways, how are you po pala, ma'am? Okay. Have you noticed any noticeable changes in your face, head or neck, or any pain or discomfort, ma'am?
Back pain.
Do you have any question before we begin? Okay. Now we can now proceed to the first part of the assessment, which is inspection. So the first thing that we're going to inspect is the head and the face for any sign of discoloration, any signs of asymmetry, or unequal distribution of facial hair. No. So, as I was inspecting the face of my client, it seems that the color of the face is normal and the facial features are also symmetrical and there's no sign of excessive hair growth. So, everything seems normal. Ma'am, can you raise your eyebrows for me? Can you smile? Okay. So, if you notice any dropping of the face that may indicate stroke or Bell's palsy, you are going to take note of that. Ma'am, I am going to put my hands on your head. Will that be okay for you?
Yes.
So, the next thing that we want to do is to palpate the skull of the client, and we will do this in order to fill in a sense of lumps, bumps, or depression in the skull. So, as I was palpitating the skull of the client, there is no signs of lumps or skull depression. Okay, so everything's normal. Alright, so after that, we can now cover the areas that are not going to be examined. So we have here a towel, so if there are any areas which are exposed, we want to cover them in order to provide warmth and also privacy to our client. Now, let us proceed to the inspection of the eye. So, the first thing that we want to inspect is the external eye structure. But before that, we are going to ask our patient some questions. So, Miss Alexa, do you have any trouble on your eyesight? Any injury or surgery that you went through? Okay. Any allergies that is affecting your eyes or any discomfort? Okay, so I will be inspecting external eye structure, and this includes your eyebrows, eyelids, eyelashes, and also your eyes. Now we can proceed to the inspecting the conjunctiva. sclera, and cornea of the client. So in inspecting the cornea of the client, we want to have the test for the corneal reflex, and in order to do that, we need to grab our pen light and shine the light just in the middle of the nose of the client. So what are we trying to look for here is the spot where the light is being reflected. If the light is reflected at the same spot, then it means normal. But if the light is reflected not at the same spot, that would be abnormal. And that would already indicate strabismus, so we want to take over that. Ma'am? Next thing that we want to inspect would be the conjunctiva and sclera of the client. So here, we want to take note of the color of the sclera, because if the sclera turns yellowish, that would already leaking to jaundice. So we want to take note of that to prevent further complications. We also want to take note of any swelling or edema on the conjunctiva, because if there are any, that would already indicate chemosis. So we also want to take note of that. So now we want to take a look on the glabellar conjunctiva of our client. And as we do this, we want to instruct our client to look up as we pull the lower of her eyes downward, and we want to instruct her to look down as we pull the eyelids upward. Ma'am? Ma'am, can you look up for me? Okay. Look down, ma'am. Alright. Glabellar conjunctiva seems good, so that is okay. Now let us perform the cover-uncover test. And we perform that to ensure that the alignment of the eyes of our client is all normal. If the client shows any sign of exophoria or esophoria, we will go in to take note of that. So let us now see. Ma'am, can you look at me? Now we are going to examine the pupils of the client, and examining the pupils, we need to use the Perla pattern. So the pupils should be equal, should be round, should be reactive, and should be light reacting, and the accommodation is good. So let's see. Now we are going to examine the pupils of the client, and examining the pupil, we need to use the Perla pattern. So the pupil should be equal, should be round, should be reactive, should be light reacting, and accommodation is good. So let's see. Ma'am, can you look at me? Okay, I'm going to close first the light. Ma'am, can you look at me, ma'am? Alright, we can now proceed to test the peculiarity convergence and accommodation reflex of the pupils of our client. So what is peculiarity convergence? That is the ability of the eyes to move inward as we move an object closer to the face, and the accommodation reflex is the ability of the eye to focus its visual attention on the object nearing the face. Okay, let's do the procedure. Ma'am, can you look at this? Don't move your head, ma'am, just your eyes. Alright. So now we are going to proceed in the assessing of the visual acuity of the client using the Snellen chart. So I have here my cards. Ma'am, can you please stand up? Now we are going to proceed in the assessing the visual acuity of the client using the Snellen chart. So I have here my card. We will use this later. Ma'am, kindly read the letter that you can read, starting with the smallest letter that you can read.
F, C, F, D, O, F, E, L, C, E, T, O, P, F, E, D, D, Z, POLEFP, JCFDE, DFCEP, DEPLJOT, PFE.
Alright. Again, ma'am.
PJCFDE, DFCEP, DEPLJOT, PFE.
Ma'am.
FJCFDE, DFCEP, DEPLJOT, PFE.
Alright, so the acuity of our client seems normal.